Ottawa announces $240 million for virtual healthcare services during COVID-19 crisis.
Over the last 4 months, Canada has faced challenge and heartbreak on a scale we could never have expected. So if you're feeling overwhelmed, that's understandable. If you need support, that's okay. In April, we launched Wellness Together Canada, a website where you can find people to talk to if you're in crisis. And today, we're taking another step forward. Our government is investing over $240 million to bring healthcare online. We're expanding existing online tools, creating new virtual platforms for mental health and for primary care. Let me start with a new platform for mental health. Whether you're looking for strategies to manage stress or support from a professional, this will be a resource for you. And if you're part of a marginalized community and you need specialized tools, well, there'll be specific help for you as well. If we can provide mental health support online, there's no reason we can't leverage technology in other areas of healthcare too. This $240 million investment will also include funding for virtual care for times when you don't need to see a doctor in person. Just take video conferencing. By helping doctors run appointments online, you can stay safe at home while getting care, and our hospitals can stay focused on those who need it most. If we can use apps to order dinner and video chats to stay in touch with family, we can use new technology to keep each other healthy.
The federal government will put $240 million toward moving mental health and primary care services online in an effort to combat concerns over mental and physical well-being during the COVID-19 crisis, Prime Minister Justin Trudeau announced Sunday. The Prime Minister said a new mental health platform will provide strategies for managing stress with specific help for those from marginalized communities. Money will also be funneled into providing virtual primary care for patients who don't need to visit a doctor's office. By helping doctors run appointments online, you can stay safe at home while getting care, and our hospitals can stay focused on those who need it most, Trudeau said. If we can use apps to order dinner and video chats to stay in touch with family, we can use new technology to keep each other healthy.
Think outside the box. When Canadian researchers have a solid lead, we need to make sure they can follow it up. That's exactly what we've been doing over the last 2 months, and we're starting to see real results. Today, I can announce that we're investing over $175 million to support the Canadian company AbCellera for their very promising COVID-19 research. They've identified antibodies that could be used in drugs to treat this virus. This new funding will help them continue their vital work and will support human trials beginning as early as July. But until we have effective treatments, or better yet, a vaccine, we still need a reliable supply of everything from masks to ventilators. So later today, Minister Anand will announce the details of a new COVID-19 Supply Council. This council will be tasked with finding innovative solutions to ensure our country continues to have the vital supplies necessary to keep Canadians safe.
Last month, Health Minister Patty Hajdu unveiled an online portal aimed at linking Canadians of all ages to support workers and mental health professionals during the COVID-19 pandemic. The launch came as some experts warned of an eco-pandemic as secondary public health crisis revolving around mental illness and substance use due to the widespread impact of the novel coronavirus. The economic fallout from the pandemic has led to many Canadians worrying about their financial stability, and lack of social support due to prolonged isolation. Safety fears from frontline workers are further compounding mental health concerns across the country. The Prime Minister also addressed a previously announced top-up to the Canada Child Benefit that will see eligible families receiving an extra $300 per child as part of their regular May payment. Government establishes procurement supply group. During today's noon briefing,
Parents, I know this is a tough time right now to be raising kids. Right now, you should be able to focus on keeping your family safe, not about worrying about the bills. So, this May, you'll get more help through the Canada Child Benefit. When you receive this month's payment, you'll see an extra $300 per child. For families with 2 kids, that means an extra $600. For 3 kids, an extra $900, and so on. This is money for whatever you need, whether it's online tutoring or groceries. And to all the kids out there, I know things are hard for you too. I know you miss your friends, and it's not always easy to do your schoolwork online. But this isn't going to last forever. So keep planning fun things to do with your friends once this is over. Keep up on your homework, and remember, we're going to get through this together. So thanks for all your help around the house, with your parents, and on sticking together through this difficult time.
Procurement Minister Anita Anand is set to provide an update on the status of Canada's procurement efforts. Anand will share details on a new federal COVID-19 supply council, which will be tasked with finding solutions to keep Canada stocked with the necessary medical and protective equipment throughout the pandemic. Until we have effective treatments, or better yet a vaccine, we'll still need a reliable supply of everything from masks to ventilators, Trudeau said. As part of Sunday's announcement, the Prime Minister revealed an additional $175 million for the Vancouver-based biotech firm of Celera, a company that he said has identified antibodies for use in potential drugs to treat the virus. The funding is expected to help the company carry out human trials, which Trudeau said could start as early as July.